Thank you. Good morning, good afternoon, and good evening. Welcome to the 1606th day of continuous and uninterrupted Zoom session of IFPH. Let us start the day's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. SHIBILA T K. He's graduated from Government Homeopathy Medical College, Trivandrum, Kerala, India. Worked at TK's Homeopathy Clinic in Malappuram, that's also in Kerala, for 6 years. Now practicing in Qatar. The topic is Lichen Planus and its homeopathic management. We all know that it's always difficult to treat the skin diseases, not only to treat but also to diagnose, because a lot of complexions and complications are there. So we are very eager to hear what is the management, how he is managing. So on behalf of IFPH, I welcome Dr. SHIBILA. You can have the platform for the next 45 minutes. Over to you. Please proceed.
Okay. Can you hear me, sir?
Yes, please.
Yes, okay. Respected Manoj sir, Dinesh sir, and PP Salam sir. Thank you for giving a wonderful opportunity to present a topic on the topic lichen planus, and let me delve into my topic. Okay. Is the screen visible, sir?
No, not started.
Not started. You can't see, right?
No, not yet.
Okay, let me check. Okay.
Yes, now started. Yes. Please select your file.
Okay.
Lichen Planus is there on the screen, top side. Just open that.
Wait.
It's again disappeared.
Wait. Now it's okay? Okay, wait.
It's Microsoft.
PowerPoint? Okay.
Yes.
Okay, let's start, sir.
Okay, very good.
Okay.
Yes.
Okay. My topic is lichen planus. Okay, we all know that lichen planus is a autoimmune disorder. And lichen planus is an acute or chronic inflammatory dermatosis involving skin and or mucous membrane that resembles lichens. It is most commonly seen in 30 to 60 years of age. And they are characterized by polygonal, flat-topped, violaceous papules and plaques with overlying reticulated fine white scale, which means becomes striae, commonly affecting dorsal hands, flexural wrist and forearm, trunk, anterior lower legs, and oral mucosa. And the common etiology is unknown. It is idiopathic in most cases, but it is evident that cell-mediated immunity plays a major role. Majority of the infiltrate contain CD8 plus and CD45 RO plus memory cells. And also another cause is drugs such as beta blockers, antimalarials, thiazides, gold and mercury salts, and infection with hepatitis C virus result in altered cell-mediated immunity. If a patient having say, hepatitis C, it is a 4 to 5% chance to get lichen planus rather than normal people. And also if they are using any drugs like beta blockers and or any after using any steroids, they may also have more prone to get lichen planus. And the main pathology is it is the epidermal hyperkeratosis and hypergranulosis, acanthosis, basal cell degeneration, and a band like lymphohistiocytic infiltrate in the upper dermis. Mainly the keratinocytes are attacked. And the histopathology includes parakeratosis and slight acanthosis of the epithelium. And we can see in the microscopic examination, we can see a sawtooth ridges in between and the junction between the epidermal and dermal layers. And liquefaction degeneration of the basal layer with apoptotic keratinocytes referred to as sevoid, colloid, hyaline, or cytoid bodies. An amorphous band of eosinophilic material at the basement membrane composed of fibrin or fibrinogen. A band like lymphocytic infiltrate immediately subject to the epithelium. And then lichen planus is mainly classified into 11 types based on their site they involve or by their morphology. And their lichen planus may be categorized as affecting mucosal or cutaneous surfaces. Cutaneous forms mainly include scalp, skin, and nails. Mucosal forms, those affecting the lining of GIT, mouth, pharynx, esophagus, stomach, anus, larynx, and other mucosal surfaces, including genitals, peritoneum, ears, nose, bladder, and conjunctiva of the eyes. And we can enter into their classification. They are classified into 11 types. And the first one is papular. It is mainly a classical cutaneous type. It means cutaneous lichen planus. They have a shiny red or purple colored appearance. They have a flat topped papule. And the lesions have thin, transparent, and adherent scale. Fine, there we can see the most common symptom, that is we call it as Wickham striae, which means a fine whitish point or lacy lines may be seen on the surface of well developed papules. We can see this white lace like appearance on the above the rash. This is the picture. And okay, and the second one is annular or ring shaped lesions that develop gradually from single small pigmented spots into circular groups of papules with clear unaffected skin in the center. These lesions may very slowly enlarge, co-join, and morph into large irregular bands, sometimes accompanied by lines. And annular cutaneous lichen planus is uncommon and classically involves the male genitalia in glans penis and penile shaft, groin, axilla, and also in the extremities. The annular lichen planus. And then third one is linear type. Linear type is mainly commonly we can see after an injury or a trauma or a scratch to the lichen planus. They are arranged in a line called Basco line, and this pattern is developed after the secondary to trauma or an injury. They are called carbonization or concomitantly a spontaneous isolated eruption are usually on the extremities, and we can rarely seen on the face. Then fourth one is hypertrophic. It is a hyperkeratotic, thick, pruritic, red-brown to purple gray plaques with follicular exudation. Hypertrophic cutaneous lichen planus commonly involves extremities, interphalangeal joints, and anterior legs in a symmetrical distribution. This form is also known as lichen planus verrucosus. These are the okay, and then the fifth one is atrophic type. This is mainly we can characterize by the presence of well demarcated whitish bluish papules or plaques with central superficial atrophy. And atrophic cutaneous lichen planus is the clinical endpoint of chronic annular or hypertrophic lichen planus with atrophic lesions. The use of potent topical corticosteroids for a long term may predispose the patient to develop atrophic lesions. These atrophic lesions are more commonly affected after the use of corticosteroids for a prolonged time. And then sixth one is a bullous. It is a rare type, bullous type, and is a development of vesicles and bullous with skin lesions. It's a rare variant and also known as vesiculobullous lichen planus. And then seventh one is actinic. It is also a rare form presenting a nummular patches or plaque with hypopigmented halos surrounding a hyperpigmented center. Actinic cutaneous lichen planus is more prevalent in African Americans, Indians, and Middle East individuals, and commonly affect the sun-exposed areas. And then eighth type is ulcerative. This morphology is characterized by chronic painful bullae and ulceration of the feet, often with cicatricial sequelae evident. This is a rare variant of lichen planus. And then this is the okay. And the ninth type is pigmented. This morphology is characterized by hyperpigmented dark brown macules in sun-exposed areas and flexural folds. This is a rare variant of lichen planus. And the 10th one is follicular, characterized by follicular, flat, elevated, or hemispherical erythematous papules with or without keratosis presenting in group or disseminated. The Graham-Little-Piccardie-Lazar syndrome seen in a familial pattern and also predominantly in women is characterized by the appearance of follicular lichen planus on the trunk with lichen planus follicularis decalvans on the scalp. This means we can see the lichen planus on the scalp and also in three places we can see also in the axillary region and also in the body surface also. This is we are calling the Graham-Little-Piccardie-Lazar syndrome. And then follicular lichen planus on the scalp is more likely to lead to scarring alopecia. And the 11th one is inverse type. It is characterized by extensive erythematous lesions with poorly defined borders and in part with lichenification. Inverse lichen planus typically affect the axilla, inguinal creases, limb flexors, and submammary region. Pigmentation of the individual lesions at these inverse locations are typical. Additionally, keratotic papules and erosions with a bizarre configurations can occur. And clinically, we were studying the lichen planus in an easy way with in an English alphabet letter P. Do any of you know that? Can you tell me that 6 P's? That 6 P's are it is very easy to identify this lichen planus clinically because if we remember the letter 6 P, that is P. First one is planar, that is flat topped appearance. Then second one is it is purple color appearance. Then third one is it is pruritic, that means itching. And then fourth one is they are mainly we can see two types, mainly papular type. Means if it is less than 0.5 millimeter size, we can call it as papular type of lichen planus, and if it is size above 5 millimeter and all, we can call plaques. That is and also polygonal. That's why it is the very easy method to recognize lichen planus in a clinic. That is the planar, purple, polygonal, pruritic, papules, and plaques. This rash after regressing is likely to leave an area of hyperpigmentation that slowly fades. That said, a variety of other lesions can also occur. And the main diagnoses are patient history and clinical presentations need to be taken to diagnose lichen planus. Patients with suspected cutaneous lichen planus need to be evaluated clinically through patient's interview and physical examination. Mainly, we are homeopaths. We are doing only the clinical examination, or by seeing their symptoms. Most of in the cases we can see the violet purple appearance, and becomes are also visible during microscopic examination of cutaneous lesions of lichen planus. And to confirm lichen planus, we can use the method biopsy. One means sponge biopsy is used to know the of deficient depth to mid dermis is also usually significant. And also we use direct immunofluorescence can be useful in patients with bullous lesions to differentiate the condition from an autoimmune vesiculobullous disease. And also presence of associated symptoms may be with example with pain or burning. And medication the patients are taking within the few weeks to months after drug initiation. Of the patients, if we can ask them whether they have taken any corticosteroids for a long period or not. And example antihypertensives, antidepressants, diuretics, and then non-steroidal NSAIDs, etc. to evaluate for the possibility of an oral drug eruption. And history of dental restorations, use of dental appliances or oral exposure to substance that may cause oral contact eruptions. Example, dental composites, cobalt chromium based dentals, because when we have a filling of our dental cavities, it may contain the presence of gold or mercury metal like that. It may also cause the lichen planus, leads to the formation of lichen planus. And the prognosis, cutaneous lichen planus lesions typically resolve within 6 months to a year. And however, some variants such as hypertrophic variant might persist for years if left untreated or unmonitored. It is found that cutaneous lichen planus does not carry a risk of skin cancer. It is only from the mucosal type it may have the chance to turn it to cancer, because most of the patients are not aware of that, because they all are thinking that it will turn to cancer, and like that only 0.4 to 4% person may turn into the cancerous condition. In contrast to cutaneous lichen planus, which is self-limited, lichen planus lesions in the mouth may persist for many years and tend to be difficult to treat, with relapses being common. It is found that patients with erythematosus or erosive oral lichen planus have a higher risk of oral squamous cell carcinoma compared to patients diagnosed with other variants. And due to the possibility of that oral lichen planus may increase the risk for oral cancer, we can tell them that to avoid cigarettes or smoking and alcohol use like that. May increase the risk for oral cancer. Patients with oral lichen planus are encouraged to avoid activities known to increase the risk for oral cancer, such as smoking and alcohol use. And as a patient with oral lichen planus should be followed up at least every 6 to 12 months to assess the disease activity, changes its symptom, or even detect early signs of malignancy. And then we can move to the therapeutic part. Okay. Synthesis repertory, mainly skin eruptions, lichen planus. In complete repertory, skin lichen planus, main medicines are anti-incrude, asalb, acidate, jugular cineraria, and calibic sulfuric iodate. Murphy's repertory disease, lichen planus, anti-crude, acidate, calibic, sulfuridatum, anti-crude, acidatum, calibic, sulfuridatum. Then first medicine is sulfur iodatum. Papular eruption on face, cold sores on lips, boils on neck, and barber's itch, lichen planus, arms covered with itching rash, hair feels as if erect. And sulfur, then the dry, scaly, unhealthy, even little injury separates freckles, itching, burning, worse, scratching, and washing. Pimply eruption, pustules, ruggeds, hangnails, excoriation, especially in folds. We can see in lycopodium also. Skin affections after local medication. Pruritus, especially from warmth, is evening, often recurs in springtime in damp weather. And then syphilinum, ulceration of mouth, nose, genitals, skin. Reddish brown eruption with a disagreeable odor. Extreme emaciation. And antimonium crude, all the conditions are aggravated by heat and cold bathing, cannot bear heat of sun, sensitive to cold bathing, thick, hard, honey-colored scabs, scaly pustular eruptions, with burning and itching. They have worse at night. And the nasal, it is itching, burning, swelling, edema, eruption. Papular, dry, rough, scaly. Worse, cold and scratching, icy coldness of the body, ulceration of mouth with dryness and burning heat, and tearing needle-like pains, burning, lips black, livid, then debility, exhaustion and restlessness with night aggravation are most important. Great exhaustion after the slightest exertion. The nasoiodatum, dry, scaly, itching, marked exfoliation of skin in large scales, leaving a raw, exuding surface beneath, debilitating night sweats also there. Jugular cinerea, red, like flesh of scarlatina, itching and pricking when heated, pustules, eczema, especially on lower extremities, sacrum and hands, eczema and erysipelatous redness. Callibike, tongue map, red, shining, smooth and dry, with dysentery, broad, flat, indented, thickly coated, papular eruptions, pustular eruption, resembling smallpox, with burning pain, itching with vesicular eruption. Then calliidatum, they have the purple spots, worse on the legs, rough nodules all over, worse any covering, heat of the body is intense, and diffused sensitiveness is also there. Then dulcamera, their pruritus, always worse in cold, wet weather, vesicular eruptions, sensitive bleeding ulcers, little boils, humid eruptions on face, genitals, hands, etc. Thick brown yellow crust, bleeding when scratched. Then Merksol, skin almost constantly moist, persistent dryness of the skin, contraindicates mercurius, excessive odorous viscid perspiration, worse at night, general tendency to free perspiration, but the patient is not relieved thereby, vesicular and pustular eruptions, itching, worse from warmth of the bird, cresta lactea, yellowish brown crust, considerable suppuration. And phosphoric acid, burning, red rash, formication in various parts, falling out of the air, lips dry, cracked. Then sarsaparilla, it is emaciated, shriveled, lies in folds. Same symptom is for the abdotanum and sanicula. Dry, flabby, herpetic eruptions, ulcers, rash from exposure to open air, dry, itching, comes on in spring, becomes crusty, skin cracked on hands and feet, skin hard, indurated, summer cutaneous affections, onychia, ulceration around ends of fingers, cutting sensation under nails, eruptions following hot weather and vaccinations. Sepia, eruptions in isolated spots, itching not relieved by scratching, worse in bends of elbow and knees, ringworm-like eruption every spring, excessive sensibility of skin, soreness of skin and humid places in bends of joints, itching in different parts, face, arms, hands, back, hips, abdomen and genital, which changes to a burning sensation. And Staphylococcus agria, this is scald head with yellow scab, smells badly, itches very much. Exanthema on cheeks, face, or particularly if it is yellow with a creeping itching. Eruptions of head, ears, face, and body, thick scabs, dry and itch violently. Scratching changes location of itching. And anacardium oriental, intense itching with mental irritability, vesicular eruption, swelling, urticaria. Eruption like that of poison oak, xerophile, grindel, and croton are also show the same symptom, lichen planus. Selenium, itching about the ankles and folds of skin between fingers, and then itching about finger joints and between fingers in palms, Vesicular eruptions between fingers, restors and anacardium also have the same symptoms. And then lascivious thoughts with impotency, mental labor fatigue, extreme sadness, abject despair, uncompromising melancholy. Phosphorus. Wounds bleed very much even if small. They heal and break out again. Jaundice. Little ulcer outside of large ones. Petechiae, ecchymosis, purpura hemorrhagia, scurvy, fungus hematodes, and excrescences. Oversensitiveness of all the senses to external impressions, light, noise, odors, touch. Then restlessness, fidgety, move continually, cannot sit or stand still a moment. Restless, fidgety feet have the symptom of zinc. Burning in spots along the spine, between the scapula, hemorrhage diathesis, small wounds, bleed profuse. Then sulf, an abscess, suppurating glands are very sensitive, papules prone to suppurate and extend, acne in youth, suppurate with pricky pain, easily bleed, angioneurotic edema, unhealthy skin, every little injury suppurates, putrid ulcers surrounded by little pimples, great sensitiveness to slightest touch. Then sorinum, dirty, dingy look, dry, lusterless, rough hair, intolerable itching, herpetic eruptions, especially on scalp and bends of joints with itching, worse from warmth of blood. Sebaceous glands secrete excessively, oily skin, eruption behind ears, crusty eruption all over. Xerophilum, erythema with vesication and intense itching, stinging and burning, blisters like little lumps, skin rough and cracked, feels like leather, dermatitis especially around knee. Dermatitis erecta, they have the red, burning, vesicular, scaly, scabby. Itches terribly, worse, washing in cold water, eruptions over face and hands and scalp around occiput, neuralgic pains in various parts. Then raphitis, it includes rough, hard, persistent dryness of portions of skin unaffected by eczema, rawness in bends of limbs, groins, neck, behind ears, eruptions oozing out a sticky exudation. Mancinella, skin symptoms are more marked. Dermatitis with excessive vesiculation, oozing of a sticky serum, and formation of crust. Intense erythema, vesicles, erysipelas, large blisters as from scalds. Heavy brown crust and scabs, pemphigus. Chrysorubinum acts as a powerful irritant of the skin. They are used successfully in skin diseases, vesicular or squamous lesions associated with foul-smelling discharges and crust formation, tending to become confluent and to give the appearance of a single crust covering the entire area. Violent itching of thighs, legs, and ears. Dry, scaly eruption, especially around eyes and ears, scabs with pus underneath. Euphorbia lathyrus. Fine bran-like desquamation following erythema. Eruptions rough, scaly, smarting and burning. When scratched forms deep, ragged ulcers, skin where ulcer remain red, erythema beginning on uncovered parts on face and spreading all over the body, glossy, rough, edematous with burning and smarting. Juglans regia, crusta lactea, soreness around ears, chancre-like ulcers, axillary gland suppurate, itches violently at night. Juglans cinerea, exanthematous eruption resembling flesh of scarlatina, eruptions resembling eczema, simplex or upper chest, with itching, pricking when heated by overexertion. Pustules on thighs, hips, and knees with itching and burning. A few pustules on body, face, and arms. Itching in spots, now here, now there. Itching on arms, ameliorated by scratching. Itching with burning. Itching on head, neck, and shoulders with pricking. Itching on arms with burning and redness. Sulfonalum, discolored patches like purpura on skin, patches of erythema of intensity proportionate to dose. First one on inner side of first phalanx of right little finger, over proximal ends of metacarpal bones of thumb and index, on posterior surface of forearm, a little below elbow on prepuce, and erythematous measles like eruption. Oxalicum acidum. Skin very sensitive sensation during shaving as from chafing, marbled skin, mottled in circular patches, skin of face, head, chest and knees covered with red spots or petechia appearing as if best spattered with blood. Itching on neck or fingers. Itching eruption with redness. Natrum salicylica. It is intense erythematous rash, pemphigoid eruption on hands and other parts of body. On forehead, face and legs, skin very red in circumscribed patches, redness disappearing on pressure. Okay, Agaricus muscarius, it is burning, itching, redness and swelling, circumscribed erythematous, papular and pustular and edematous lesions. Opium, they have skin bluish with blue spots, redness and continued itching of skin with small round and colorless elevations. Erythema, scarlatina-like eruptions, perforaceous desquamation or else in large plaques, desquamation of epidermis. And then lacusis, hot perspiration, bluish, purplish appearance, dark blisters, worse after sleep Calibic also have the same symptom. Lacusis sleeps into aggravation. Ailments that come on during sleep. Calcaria has also the same symptom. And just left side in the spring, warm bath. Tarantula, it is an ecchymosed spots, vesicular eruption like cresta lactea, a small callosity, whitish, indolent, in right palm between middle and index fingers, increased with heat and pain, extended, broke, leaving an ulcer with callus urge, healed, leaving a small scar. Sanicula. It is skin covered with fine rash all over the body, body attended with severe itching at night, a copper-colored syphilitic sores, skin dry and flabby, itching aggravated by scratching, large scabs on upper lip, constantly picking them till they bleed, itching eruptions in bird, especially under chin, aggravation when warm. Natrum arsenicum, it has a squamous eruption, scales thin, white, and when removed, leave skin slightly reddened. If scales remain, they cause itching and aggravated when warm from exercise. Manganum, burning all over the skin in evening and when rising from bed, itching tetanus. The skin does not heal easily. Every injury tends to ulceration. Voluptuous itching ameliorated by scratching, itching in hollow of knee and on shin. And symptoms include skin usually white, almost transparent, swelling and dry erysipelatous redness, and lichen planus. And then there is a great sensitiveness of the surface to touch, general soreness. Every hair is painful to contact, great debility as if he had worked hard, is compelled to lie down, tired and bruised feeling. Latrodactus catipo. It is a small red spot like flea bite, a bright scarlet papular eruption on both lower limbs, which stung and burned like fire. Surface raised, as large round as teacup, The raised part white with red halo with pain, swelling, and pain ameliorated by spirits of ammonia. Calichloricum. It has small purple maculae on forearms, rash with painful pimples on shoulder, and the numerous small red papules are seen. Itching vesicles on back of right hand, itching over whole body, and aggravated in evening in bed. Okay, that's all. Sir, if you any of you have any clinical experience, can you share this here? Because actually, I got only 1 or 2 cases in the case of lichen planus, and they are only in the first stage, and I gave the patient the remedy based on only their symptomatic symptoms, only their based on their mind. I gave natramur 30 to 2 doses, and the symptoms subside, and he is cured. And I have only one case of that, and also I gave in another case, I haven't got any symptoms, and based on I gave only sulfur iodatum 202 doses. He also cured, but I have, other than these 2 cases, I haven't got any other cases. If any of you have such experience, please share here.
Okay. Thank you, Dr. Shibla. You have done a good job. But one thing I would like to add is that no need of mentioning this much of medicines. What is needed is you just mention about the characteristic features. Otherwise, nobody will not remember this.
Okay.
Especially the location. You just mentioned this Staphylococcus aureus. It's changing the position. That's all. That's all. That is all. The whole thing is needed there. So whenever you present, you must concentrate on how to teach material medicine. That's the most important. That is a great tragedy that happened in homeopathy. It's a wonderful subject, but nobody actually perceived. They just read all the symptoms, but who can remember it? But if you are an expert, just like Ismail said, sir, he will not tell all the symptoms. He will tell 1% that will remember. No doubt about that. So you are a young talented person, definitely don't doubt about that. So this is just a humble request from me. It's time for discussion. Those who would like to participate, please raise your hand. And I think Dr. Geeta Madam is there, a teacher. Geeta Madam, are you there? I think you are a student from Government Homeopathy.
Yeah, Geeta Madam, I am her student, Pathology department. Yes.
Definitely. He's a most experienced person. Madam, are you there? Yes, madam, would you please unmute? Your student is here. Yes, madam, please. We are happy to see you. Yes, please.
Shibla, I am very happy to see you here.
I am also.
Very nice presentation. You have touched all the nook and corner of this LICHEN PLANUS.
Thank you, ma'am.
Okay. Then.
Madam,
I am so glad. I am the batch of Geeti, Surendra, and Saumya.
I remember. I know. Your batch. Shibla, I had an experience. That case was treated with antimtat. That patient was suffering from respiratory complaints. And she was having this lichen planus also. And that eruptions leave almost a bluish stain. It was on her feet. Okay. And after healing the eruption, there was a bluish stain. Then on the basis of respiratory complaints, I prescribed antimtat 200. And
this is just mentioned. Concomitant is an important factor. You must always add or give importance to the concomitants. As rightly mentioned by Geeta Madam, is accompanied with respiratory symptoms. That's the most characteristic in homeopathy. Okay.
Okay.
Then Shibla, about the miasmatic cleavage, I think it shows a mixed miasm. Both usually the miasm behind this lichen planus is sora and syphilis. Because itching, scratching, then followed by scaly desquamation. In the beginning stage, there is powdery desquamation, and later it usually changes into scaly desquamation. That indicates sora and syphilis. Then this chronicity of the disease and this destructive nature of the nails, hair, mucous membrane that indicates syphilitic miasm. Then thickening of the skin, that is a psychotic tendency. So I think it covers all the miasms in different stages.
Yeah.
So this lichen planus is a Greek word that means tree moss.
Flat top.
Tree moss. Okay.
Tree moss.
Flat top eruptions. Then I have another patient, that oral lesion. There it is getting better with lachesis.
Okay.
Bleeding is also there, lachesis. It's a reticulum-like structure there.
Okay.
Usually oral lesion precedes skin lesion. In some cases, first there is some oral lesion, it is followed by skin lesion. Okay. You presented it very nicely. Thank you, Shibila, and I'm happy to see you after
Me
years.
also.
Okay.
You know that you are really proud of the student, no doubt about that. That is why I invited. We want to share that moments also, madam. Thank you. Now, okay. Please continue, madam. Now, Dr. Indanil, doctor, please, you unmute now.
Okay, sir, can you hear me? Yeah. Doctor, first I will thank you for taking a very hard topic and explaining this to us. I would like to just share 2-3 things. In lichen planus, many a times, I've experienced that at what stage the patient comes to us, that is very important. It's a chronic entity. Suppose you said that 6 P's. So if it comes in a purple discoloration, it is a strongly psychotic miasm. I remember a case where there were oral lesions and Merck sol was given, but it did not work. And I was surprised why it did not work, being a syphilitic miasm. After studying the materia medica, it showed that dryness of the skin is a contraindication for mercury. It is a single line, which I was not aware at all. And all the skin lesions usually are dry, scaly, they are bleeding, scratching, aggravation at night. And lastly, I have experienced, would like to share that the disease triggers because of psychosomatic conditions. I don't know what is your observation. A patient in stress usually gets flare up. And when the patient is not in stress, they are very comfortable. So like we can think of these 2-3 things, like oral lichen planus. The remedies like thiocyanonium, silicia, they also help a lot to prevent the patient from trismus, that is not opening the mouth. That is yeah. So the 2-3 cases also I had seen, but in what stage?
Which are the potencies you give, sir? Which are the potencies you give?
The thiocyanonium should be given in decimal scale, not in centesimal scale. Usually 6x is advised, that is there. And silicia, infrequent repetition should be there, because otherwise it causes the pus formation and flaring up of the skin lesions. Of course, we should not immediately rush to give constitutional medicine because it aggravates the conditions. On the local state where the patient has come to us, we should study that and give them a local. I follow Burnett's method. I don't know whether you are aware of it. Burnett's method. Burnett's method was this, that you cannot say that a single remedy cured the entire case. So every state of the patient, the remedy changes, and it is just like a ladder. Suppose we want to go to the first floor with a ladder, one step we go ahead from the ladder. That way, every step has different remedy, and we should give it, so it works much better. Yes,
and also, and also we can advise the patients to take more water, 2 to 3 liters of water.
Hydration should be the hydration. Skin care
management is more important.
Management.
And also we can apply coconut oil, right?
That is one of the best. One of the best. It doesn't cause suppression. It doesn't cause suppression. Rather, it keeps the skin moist. That is there.
Yeah.
So soap should be avoided.
Okay. Can we use turmeric? Turmeric, maybe mix into water and warm water and a pinch of turmeric. It is very good.
But in what sense? What does it relieve? What does it relieve?
I don't, but it is in Ayurveda and all, they are telling that turmeric is a very good thing.
I will just explain what is known to me. You are expert. Turmeric contains a chemical called as curcumin. And curcumin has a strong anti-cancerous as well as antibacterial activity. So if there is a pus formation, turmeric in the local water or a coconut oil will definitely work. But if there is no infection, it will not work.
Okay. And I also I known that it is to avoid pineapple. I don't know why they're telling that to avoid pineapple. In all, we can use most of the fruits, but it is better to avoid pineapple.
Okay, actually, I'm not aware of this thing.
Actually, I got knowledge only from Google. I don't know why they are telling like that.
We'll ask some dietitian. They may be more literate about this thing. Correct.
Yeah.
But you have explained very nicely. So it's I will again congratulate you for that. And very hard topic you have explained in a very simple way. Thank you.
And also for the first presentation, and I was answering before.
Very nice. Congratulations for that. Yeah.
Okay, thank you, doctor, for your comments as well as your timely interference, because these type of discussions and deliberations are needed to development of homeopathy as well as the young talented persons. If anybody would like to participate, please raise your hand. Dr. Hariharan sir, another experienced person. Hariharan sir, what is your opinion? Kindly share.
Okay, very beautiful presentation, and it is a rare disease also. See, I have covered in my experience. I have covered about 6 or 7 cases only. This LICHEN PLANUS. See, usually my method is it is not like that. See, I will take the constitutional symptoms and give the medicine. And so some external application, main external application I am doing is, see, this is a mountain ginger. That do you know mountain ginger? That is usually we say Malay Inji. Malay Inji. That is very good for external application. See, after getting this ginger, you break it and apply the external part. Within 1 week, complete that discoloration will disappear. In my experience. So, in my house, I have grown a lot of such ginger. It is not an ordinary ginger. It is grown in mountain region.
Is it available in market, sir?
No. You have to grow. You have to take it from forest and grow it in your house. See, here I am. It is grown in my house. About 10 plants. 10 plant is always in my home, and I will take it on this. This is the season of harvesting the mountain ginger.
Yes, sir. Always trying something different. This is a specialty of Dr. Hariharan sir. Thank you, sir. Yes. Dr. Sunil Raj, what is your opinion? Do you have any experience to share or something to add? Definitely. Yes, please.
Hello, Dr. Jasil Shibila. It's a very good presentation from your side. So you have covered all the types and you covered all these things. But as Dr. Manoj said, so we have to point out the exact location of the medicines or exact features of the medicines, exact aggravation modalities of the medicines, and the nature of the eruptions. So these presenting all these things, nobody will remember all these things. So you have to point out peculiar eruptions, peculiar nature of the eruptions in concern with that medicine. That will be very good. And I have got 30 years of experience, but I have only 8 or 9 cases of this lichen planus. And 2-3 cases, cannot say it is a complete cure. It may be recurring after 1 year or 2 years. That was the picture. I was in government service for, because there only will be posted there only for 2-3 years. I will be leaving that place. So anyway, I got 3-4 cases with this medicines, Maxol. I gave that Maxol. It's very, I got very good results with Maxol. 0/6 potency and 0/3 later on. Then anti-crude was another medicine which helped me. Anyway, it was a very good session, and congrats, doctor.
Yes, thank you, Dr. Samdaj. The previous Hindi session, the one fellow, I not remember his name, but he said about this. He's not at all bothering about the miasm, he just prescribed medicines. We all know that what was mentioned by Hahnemann. Dr. Samuel Hahnemann mentioned that the treatment of chronic disease, their beginning was promising, continuation less favorable, and outcome hopeless. That was the situation. So that is why we are always conscious about this miasm. One after another tandem, or the medicine should be in succession, one medicine after another one. So that type of technical knowledge is also very important in treating cases, especially chronic cases. Dr. Tanesh, what is your opinion? Is the main coordinator and backbone of this program.
Yes,
Dr. Tanesh,
yes,
please.
Dr. Shibila, it's really a very good session. And treating this kind of skin problems is entirely different thing when compared to other systems, because we need to find we get something as we used to say, that the outward expression of the internal disorder, we used to say like that. But what then one need to go into the depth of the reason and depth of the case to find what is the thing behind the illness. So yes, it seemed to be an acute disease, but it may not be. It may be a chronic disease from the very beginning itself. Unfortunately, we are not able to recognize this, or the patient is not able to recognize it. And once we take the case, we may find that there are several things that were there as obstacles in the life of the patient, and that may be the reason why these things happens. So a case taking in detail is the best thing that we have to do. I have got some cases like this, and sepia as well as natal mole. And some at times pulse satellite gave me the result, because that when that these three medicines were really constitutional according to the patient's condition. So this is what I would like to add. Anyway, congratulations for coming up with a different subject.
Okay. Now, Dr. Marianne. Dr. Marianne, are you there? Dr. Marianne Salcido.
Hello, Dr. Manoj.
Yes, please.
Oh, now it's running my camera. Hello, Dr. Shibla. It was an amazing conference. Thank you very much. I was just taking my notes because you bring us a lot of information. So thank you very much. Here we don't have too many cases to attend with homeopathy, like lichens, like cancer patients. The persons as not is so well spread homeopathy. All the people is not coming with us, but we are working on that. And about the turmeric that you told, we have a lot of studies, and we know that the anti-inflammatory effect is thanks to curcuminoid as an active ingredient. But to activate these curcuminoids, you will need a little bit of piperine that comes from pepper. So here we mix a little amount of turmeric plus pepper in a hot water just to drink. And about pineapple as a fruit, it has a lot of enzymes to prevent the chelosis around the tissues. So maybe that is the reason. And
Thank you.
just learn about natum arsenicosum, manganum, and lactodetus. That is some remedies that I never use in my life, and I never hear in America. So I will be reading, and thank you very much. And thanks to all IFPH team, because you are working so hard to bring us the best conferences in homeopathy. Thanks, Dr. Manoj.
Thank
And
you,
thanks,
Dr.
Dr.
Marianne.
Shibla.
She's really a hardworking homeopathic physician from Bolivia, always participating and supporting IFPH So let me thank once again for you for participation as well as supporting IFPH. Thank you, Dr. Maria. If anybody to comment or make some suggestions, because it is up to you after listening 45 to 1 hour, or minutes 1 hour, it is up to you to make some comments or to add something. So it's a platform for exchanging the views. I think you have mentioned about 40 medicines for this condition, isn't it? Am I right?
Yeah.
Yes. So there is some important significance of homeopathy in the therapeutic field, having more than 3 dozens of medicines for this condition. What about other systems? It's not easy. They only have 3 or 4, 5 medicines, and that too often banned or after modified. There's some questions that about in the chat box. Please listen that, Dr. Sribna.
Hangnail. What's your opinion about hangnail? Somebody.
Yes.
Dr. Devi Desari, you make
Dasari, yes.
what
is hangnail? That's a question.
we used to say that it's a fungal infection.
Okay. Now another is Dr. Antimony crude, very helpful in lichen with comparison as a concomitant. Okay.
Silicia and as well as graphitis are very good remedy for this hangnail. Hangnail.
I think that the skin disease most productive is the 50 millismol potency is most important because it will not produce much aggravation than the centimole scale potencies. That's why Hahnemann often might have developed to reduce the aggravation. But why he got that much aggravation is the most important question. Because he was master in medicine. He is a prover also. So he know each and every movement, alterations. But we are not at all that much acquainted with that. So he always prescribe remedies. He often prescribe medicines. So that is why we will not get much aggravation. That is why Hahnemann always indicating about the aggravation and how to reduce that. Now, Ram Parvesh sir, without your voice, it will not complete. Yes, sir, please. Yes.
Thank you, Dr. Manoj ji and Dr. Dhanesh ji and everyone. Namaskar. Good evening. Congratulations, Dr. SHIBILA. Very good presentation. Lichen planus, skin disease, eruption of skin. According to law of homeopathic science, skin disease, skin eruption, mirror of mind. No separation. Local, external application, use of separation. The skin disease, very important. Lichen planus, only external use coconut oil, very good. And according to homeopathic medicine, constitutional, miasmatic. Without miasmatic, no eruption. Sora is a background and syphilis. So lichen planus, Sora and syphilis, other psychotic. So very, very nice presentation, excellent session.
Okay, sir.
Many kinds of deals, medicine.
Yes.
Corallium rubrum, arsenic, corallium rubrum, and Marxol is a very good remedy, and biochemic remedy, Calimure 6X.
Yes, sir. Okay.
Very good. Thank you.
Now it's time to invite Abdul Salam sir to express sort of thanks. Salam, Abdul Salam sir, please unmute, sir. Are you there?
So before that, there is an announcement for tomorrow.
Yes, Dr.
Tomorrow we will have a session from Dr. Sarul Arora, and we'll be talking about 4 pillars of homeopathy practice.
Okay. Salam sir, please.
Dr. SHIBILA, nice presentation. Thank you for coming, and all our well wishes of IFPH. Thank you. Come again, Dr. Shibila.
Thank you, sir.
Yes, we must thank to this person.
Actually, Salam sir compelled me to present a topic.
Yes,
Not a homeopath, but he is working for a lot to promote homeopathy. He's a very
Definitely.
inspiring for us in Qatar.
We need such persons. So we must
Very
all
thank
thank to Abdul Salam sir. So with that remark, let me conclude today's English edition. Hope you will be back again tomorrow. Till then, goodbye. And Dr. Mariamma John to continue the program Malayalam.